First Choice Neurology, which is an organization that I'm part of, is being one of the first in the country to actually be able to provide this kind of system to families with children with neurodevelopmental delay. EarliPoint uses technology of eye tracking, right, combined with computerized programs that allow us to compare that particular child with thousands of typical kids of the same age. And based on that, then it allows us to look into the social scales as compared to normal children. Amazingly enough, it allows us to look at where that child is particular in the communication, in verbal communication, non-verbal communication. This is just to remind everybody, right, that the system analyzes data 120 times per second. We can actually show the parents where were the typical children the same age, where were they looking at, and where was your child looking at. When they see this and they realize the difference, right, I think, as I said, it becomes a little bit easier to accept. The average wait for an appointment with a child neurologist in the US is 18 months, right? So let's say a pediatrician gets worried about this child at age 18 months, they're going to be seen by the specialist by age 3, right? We're going to order some evaluations, that's 3.5. We're going to start with interventions at 4 years old, if we're lucky. This technology will cut down the waiting in at least 30 to 33%. What we want is for kids to be diagnosed earlier. The earlier the diagnosis is made and the earlier the interventions start, the better the prognosis for that child. As far as I know, I am the only child neurologist in private practice that has EarliPoint. We hope that at some point this is going to make a huge difference for everybody, right? And not only in the US, but all over the world.